We are very excited to have Dr. Veenoo Agarwal, medical oncology consultant at Naraina Hospital. He has been a practicing oncologist in Australia and over 20 years of experience in patient care. Welcome, Dr. Veenoo Agarwal.
Thank you.
Today, we're going to speak about lung cancer. So, my first question to you, doctor, is what is lung cancer?
Yeah. So before I explain what is lung cancer, I think it's very important one understands what cancer is. We start from a single cell inside the mother's womb, which replicates into multiple times into a healthy tissue, and then that tissue becomes an organ, and an organ, multiple organs become an individual. We're made up of about 30 trillion cells, and all of them have a capacity to divide. And inherently, there lies the problem and potential issues that can occur. Like if a cell becomes loses its ability to stop growing or is being excited to continuously grow, that's what makes it a cancerous growth or a malignant growth. And when we talk about cancers, it's uncontrolled growth of a single cell from a tissue. Now that a cell could be part of your lung, your breast, or different organs, and that's how we named the disease. So if the initial cell was part of a woman's breast, then it's breast cancer. If it was part of lung, it's called lung cancer. And therefore, there are over 100 types of different cancers because that's where based on the origins. And lung cancer essentially means that the cell originally that went rogue was part of the lung, and therefore it's called the lung cancer. One needs to also understand that all abnormal growths are not what we originally call cancer. What we call cancer is the spreading type or malignant cancers. There are benign growths which we don't worry about, like your mole and your they're all abnormal growths, but they are not necessarily cancerous.
So what are the early symptoms of lung cancer? How do we identify, and how do we make sure that we go to the doctor when we get those early symptoms?
Yes, and I think that's inherently the problem with cancer. There is no single symptom that you say that if you've got this, that's equal to cancer. If we go to just cancers, the symptoms will depend on which organ it started from. Like if you've got a liver cancer, it most probably presents with jaundice or problems with liver function. If it's a lung cancer, I'm just taking an example of the lung cancer, the most common symptom is a chronic cough, a cough that doesn't go away. You've been on antibiotics and multiple courses and it doesn't go away. Or somebody starts coughing up blood. That's a little bit scary and gets you to the doctor. Shortness of breath, chest pain, and unexplained weight loss and persistent fatigue. If you notice, none of these symptoms are very, very specific for cancer. For example, you can get a chronic cough or a coughing up blood in infection as well. As we know from corona, that if you get an infection, you can have chronic cough, you can have shortness of breath. So not everything is cancer, but they should be looked at and investigated correctly.
So for a normal, you mentioned the symptoms can be confusing. Suppose you have a cough for a long time, you go to your GP. When does the GP or when does the doctor actually say, go and see an oncologist? So you can miss the early symptoms bus if you are not carefully advised.
Yes, I don't want to spread panic here. Look, if you have a chronic cough, that could be due to an infection that is not being treated properly, or the antibiotics haven't gone long enough. And in Indian context, we can say that tuberculosis can cause chronic cough as well for a while. And not only that, simple things like viral infection can cause post-viral cough for a very long time, and hence investigation is very important. You would need training to identify, that you've gone through 1 or 2 courses of antibiotics. Our general diagnosis, common things are common. So, if you have a cough, it's more likely to be an infection rather than rather than a cancer. But if you're having cough or have excessive cough, or you have coughing up blood, the doctor would either order a chest X-ray or a CT, and then you see a spot that should not be there, or a spot that we worry about as cancer, and then we can take it further from there. But
So,
one should have the use of all these investigations and symptoms judiciously, and not panic just
right.
because we've got a cough.
So, coming to what are the investigations that you require to identify, to diagnose a cancer?
These days, I've seen the general thinking, a thought process is that we as doctors order too many tests,
Right.
but everyone needs to realize that it's a process and it's a journey that you have to diagnose, because every test that we order has a different reason for it, and there's no single test that will give us everything, because if there was, we would have been using it. So that there are various types of tests. As I was saying, there would be blood tests, lung function tests, x-rays, CT, PET, MRI, and a biopsy. All these tests are used at various times, or in either synchronicity or sequentially, to figure out what's happening. Like blood tests would kind of give us an idea whether it's an infection, whether you have anemia. Your shortness of breath could be due to an infection or an anemia itself. X-rays would give us a preliminary idea of how the lungs are behaving, and CT and PET kind of give us more information. And the last but not the least, the most important, is the biopsy. To give you an idea, this is what we see. If you look at, these are CT findings, and these are CT basically cuts you into thin slices, and you're looking from bottom upwards, and that's your liver, and you see the red and the blue signs which are abnormal. And if you can appreciate, this difficult to see even until unless you have a very trained eye.
Right.
And when we do PET, this is what we see. So it's a lot easier to see what is abnormal, and therefore these two are used sequentially. PET gives us the extent, and CT gives us the how big the lesion is. It's easier to measure lesions or the spots on a CT scan, which is not possible on the PET. And the PET helps us easier to see the extent of disease and stage the disease.
So
PET
CT
also,
is sorry. So the CT is done first, and then is the PET.
no, the CT PET are done together. So
Okay.
when we say we need a PET CT, because PET just gives us a basic localization, and the CT gives us where actually that spot is, abnormal.
So is it
spot.
one test? PET CT is a
Yeah, so it's a scan that is done over half a day. We give you two dyes. One dye is for the CT, which are basically X-rays,
right.
and PET scan is given a different dye, where we give a radionucleotide sugar, and this is what we see on a different camera. Okay.
Yeah.
And then PET also gives us a bird's eye view. These black spots is where one of the patient had cancer, and then when we do repeat the CT, it's easier to show and even appreciate that post chemotherapy the patient responded really well. So these are the different things that we can do with different kinds of tests. We understand that there is a lot of expense involved, but each expense needs to be done in order to stage a cancer. And cancer staging, as if your audience have gone through the journey, they're staged from 1 to 4, where 1 is your small or localized disease, and 4 is your metastatic spread disease. And it also helps us to decide the therapy.
So, doctor, in case of lung cancer, like we know, then in case of prostate cancer, they say it's a very slow growing disease. In case of lung cancer, I know each case would be different, but is it slow growing, or if you can quickly move from stage 1 to 4, and one really needs to be following these tests regularly?
So once you have a suspicion of cancer, your tests are done in very quick succession to avoid any delay. But when you say whether the cancer is slow growing or fast growing, that depends on type of lung cancer, and that's where the biopsy comes So the biopsy basically is a test where we take a small tissue from one of your organs. So it could be a lung biopsy, or it could be a node biopsy, or a liver biopsy. And the first thing we do is it helps us confirm that all these abnormal spots that we are seeing on the scans, they are actually cancer. Because all these abnormal spots not necessarily are cancer, and there are lots of differentials. So that's why it helps us to confirm the cancer. Then what it does is it helps us to figure out where was this original cell coming from. There are a number of tests that we can do on the biopsy to identify which was the original cell. And then it subtypes the cancer. So if you see, these are the different subtypes of cancer. There is non-small cell and small cell cancer. Small cell cancer is your traditionally very rapidly growing cancer. And on the other end, you have the non-small cell cancer, which is not that fast growing, but it is still reasonably quick. And then with the biopsy, we also do other tests like immunohistochemistry score and the next generation sequencing, which helps us identify mutations and weaknesses of the cancer, and helps us decide therapy. Because these days, chemotherapy is not your only option. And we'll talk about treatment as we go along, but it does help us identify whether you can do away with just tablets, or whether you need therapy through your veins.
So let's talk about the treatment then. Are you suggesting in some cases the treatment could be just tablets? You don't need to go through chemotherapy? Maybe you can just take us very quickly through different treatments.
Yeah, so treatment has come a long way. So when I started training, one of my mentors was retiring, and he was joking around saying, when in his day, 60, 70 years ago, they had not 60, 70, I don't know, 30, 40 years ago, they had 5 drugs. They used to put it in a pot and then shake it and take out 2 and give it to the patient.
Right.
But these days, we are having an explosion of the treatments that we can give. Number of treatment options these days. Primarily, any cancer is treated in 3 ways: your surgery, radiation therapy, and systemic therapy. So surgery is simple and everybody would understand. It's the process where we surgically excise the cancer, which is cut it off the body and try and cure the patient. Radiation is also that, where you are using either radiation or the special rays to treat the cancer. And then there are systemic therapies. I'm a specialist, medical oncologist who deals with systemic therapy, and there are a number of arsenal we have these days. Your traditional therapies, your chemotherapy, which are drugs that help to arrest the growth of the tumor cell. These days we have targeted therapy. Targeted therapy, we are actually able to see whether there are mutations, specific mutations or mistakes in the cancer cell of a particular patient, and target those. And especially patients who have never smoked, never done anything that is bad lifestyle. They have more of targeted or single mutation that is making the cancer grow. And if we block that mutation, and these are particularly tablets, if we block that mutation, the cell growth arrests, and the body takes care of the cell that is already there. So that's the best kind of outcome that you have. The overall survival in this case is the best and better than even chemotherapy. And then immunotherapy are drugs that help the immune system recognize the cancer and help the immune system to destroy the cancer cell for us. And then in future, there are other things that are coming up, which are called antibody drug conjugates. So your immune system or your own antibodies are loaded with drugs.
Right.
So they are like the guided missile with the chemotherapy attached to it. So they take the antibodies take the drugs to the cancer cell, and then they are taken inside the cancer cell, and then the chemotherapy is released. So it decreases your side effects as well. So this is an exciting time the uh, for a medical oncologist to have so many drugs than just have chemotherapy. So yes, um, to summarize, you all these drugs are oral, have an oral version, not all, but some of them have an oral version, and some have the IV version. So you can have drugs that you can just give orally and not required to be not required to be given intravenously.
So, Doctor, just one related question. You mentioned that there's exciting time, the new kind of drugs are coming out, different treatments are coming out. Do you see that doctors in India also following this? Is this something which is being practiced here, or this is your experience in Australia and other places where you have served?
No. So we do use them here, and they are used very regularly and commonly here. They are used in the targeted drugs. Immunotherapy is standard practice now, and they are used in private hospitals, government hospitals, everywhere. So the standard of care remains the same.
Right.
The standard of care remains the same. It's just that if sometimes the affordability of the latest medicines, the ones that are brand new to the market, are a little bit tough. But these are, as the day goes by, India is getting, the drugs in India are getting cheaper and cheaper and getting more and more affordable.
Okay, finally, to just request you to speak a little about screening. If somebody is worried, is there two questions actually? What kind of screening tests can be done to rule out lung cancer? And secondly, is it preventable?
Right. So these are two different questions, and I'll give a little bit long-winded answer so that you understand where I'm coming from.
Right.
So screening is basically our tests that are done on normal individuals. Normal individuals being those who don't have symptoms. They are more likely to get to detect people who have something abnormal. So they are sensitive, but they are not specific. So this is your quick bird's eye view of why screening is done. Early detection is the key. If you look at the stage 1 disease, the blue ones are the ones that are curable, and the red ones are the ones that are incurable. So even in stage 1, 2, and 3, stage 1, not everybody is curable. So early detection is the key. And what we do in screening is we take a bunch of people, do tests on all of them, and then filter out who have abnormal tests results, and then do more specific tests to identify why they have the abnormality in the screening tests.
Right.
So the problem is that if you start screening everyone, you will potentially cause more harm than good. So we usually enrich patients or people who have a high risk for developing the cancer. So generally, there have been large studies with involving patients more than 10, or involving general population more than 10 to 20,000. And it's recognized that if you have the risk factor that is more eligible for screening is a 20-pack year smoking history. When I say 20-pack year, means if you have smoked about 20 cigarettes per day for 20 years, that's right. 20 cigarettes means 1 pack for 20 years. That increases your risk for developing a cancer, and then that involves that you need a low dose. You could use a low dose CT for screening as a screening test, but it's not for a general person who's generally living a good healthy life and doing and decreasing their own risk by a healthy lifestyle. So that's where you can decrease your own risk, but screening tests are not the answer for an average Joe.
You talk about a healthy lifestyle and risk factors. Are cancers in general preventable?
So the correct answer is yes and no. And for that, you need to understand why cancers happen and the causes of cancer. Cancers generally have two kinds of risk factors. So the risk factors for cancer are tobacco. So lung cancers, particularly, if your audience can take one thing out of this talk, is tobacco, tobacco, tobacco. That is the thing to not do. That is a number one preventable cause that you can take. These days, there is even things that are worse than tobacco. That's your vapes. So although there is no definitive study, but there are studies that are showing that vaping might be worse than tobacco. Then there is your lifestyle, your obesity, wrong diet, alcohol, your genetic factors and environmental factors, and your physical activity. All these kind of in some way cause your increased risk. The non-controllable factors are your inherent genetic makeup. You cannot control who you are born to, and inherently you get your protective and the risk factors from from your parents and your family as well. So if you have, for example, a history of breast cancer in your mother's side, and all your generations had a risk of had breast cancer, you are more at risk. The other things that you can't control is like the environmental pollution and radiation. But what you can control is your life and diet. So I already told about smoking. Then alcohol consumption in moderation. When I say moderation, it's 1 unit of alcohol per day. So which means that it's one small peg of whiskey is kind of where you would put your one beer. One beer would be the maximum limit per day you can have, and you cannot bunch it. So which means that if you haven't had anything throughout the week, you cannot take your 7 units on a Sunday.
Right.
So that's your limit for alcohol consumption. Physical activity is very important because that is your immune booster, and so is a good healthy diet, which is your immune booster, and that goes a long way in preventing cancer. Vitamin D is and vitamin C are good vitamins, and exercising and having a good diet will help you prevent cancer very quickly. And that's where one should focus on, rather than focusing on taking medicines or trying to go the medicine way to try and prevent cancer.
Right. So I think you've given us a very good overview on lung cancer. My last question, and I think it's maybe not a fair question to a doctor. A lot of times you hear that this person died of lung cancer and there were no symptoms. So that really worries us. Can it happen that you really haven't had any serious symptoms, but you were suffering from lung cancer and it goes unnoticed?
So yes, and that's a problem with cancers in general. Our body is a very adaptive by nature, and it does adapt to things very till the last moment. So if you're just waiting for symptoms to develop, that kind of puts you at a risk of not noticing the symptoms that occur. Like, for example, if you are short of breath, and your body will cope. If you don't listen to your body and don't pay attention, you will feel that you're a little bit short of breath. So earlier, like one week ago, you could walk, or 1 month ago, you could walk 2 kilometers, and today you are not being able to walk 100 meters. That's where alarm bells should start ringing. Or if you are smoking and coughing up blood, you should seek a doctor's advice. What generally happens is we keep giving excuses, or it might be my head, or it might be the stress and things like that, and keep delaying it until the last moment. And that's where the cancers kind of keep growing. Now, the cancers, although it sounds like it grows every day, every hour, but that's not how usually cancers spread and grow. It takes a few months for them to grow and become stage 4. Sometimes few years. There are very small number of cancers that grow grow by the week,
Right.
and or by the day. Like small cell lung cancer is important differential that we should, and all these cancers are that grow very quickly, so we get onto it quite quickly as well.
Okay. Thank you very much for talking to us today. It's been a great learning.
Thank you very much for inviting me today.